The external urethral orifice is right here. This tube right here is the urethra, and surrounding it is the corpus spongiosum. On the dorsal side right here is the corpus cavernosum, or cavernosa, plural, and those are erectile tissue to make the penis erect. This right here is the scrotum, right here. And then we've got two layers right here. So this layer that is a white coat that covers the testes, it's the tunica vaginalis, the visceral layer. That's what's indicated right here. And then this layer here, it's kind of hard to see layers right here, but the layer that covers the testes, it literally means, you've got a membrane that covers the testes. And so the membrane that covers the testes is the tunica vaginalis, the visceral layer. But the tunica vaginalis parietal layer is lining the inside of right here. So it's like a double membrane thing. The white part that is on the outside of the testes right here, it means like white coat. So that is tunica albuginea, means like white coat. And it creates little partitions inside the testes called septa. So you can't see any of that. I'm just from what I'm saying. So if I say what's the white coat, that's tunica albuginea. If I say what membrane or what covers the outside of the testes, that's the visceral layer of the tunica vaginalis. And if I say what's lining inside of the scrotum, you'd say that's the parietal layer of the tunica vaginalis. Now this is the epididymis, and so this is where sperm finish their maturation process. This whole bit right here is the spermatic cord. So in here is the ductus deferens. Also, it's got the paniform plexus, which is the testicular vein. And then it's also got a testicular artery as well and some nerves. And so it descends through the body wall right here. So the tube that the testes descend through right here, we call that the inguinal canal. So up here is a weak spot where the males tend to get the hernias because the intestine could poke through that weak spot. Okay, so here, the ductus deferens, it comes up right here, and they're paired, and they go around the side of the bladder right here, and they go around the back side of the bladder. So around the lateral side and then around the back side. Okay? And so you can see then they're going to go internal right here. So this part right here, this is part of the ductus deferens right here. You got like this enlarged area, we call it like ampulla. And then this thing on the posterior side is the seminal vesicle. So this contributes that the sugary secretion, so it gives the sperm motility. When the sperm is going through the ductus deferens, it's via peristalsis, so it's not swimming yet. But after it gets this secretion, it can swim. And then it goes into, keep in mind this is paired. This is the ejaculatory duct. And it empties the sperm into the prostatic urethra, which is what you can see right there. And that is in the males, and it's on the underbelly side of the urinary bladder. What we can see here also is the trigone I mentioned earlier. So here is one of the ureters, and it's coming in on the posterior inferior side. So there is the ureter. And you've got one on the other side, which is shown right here. And then lastly, this is the urethra right here. And in here, this smooth muscle layer is the detrusor muscle. And in here is an internal urethral sphincter. So that would be the involuntary one. Then you can see the rugae here, those expandable ridges right here. And this is lined with the transitional epithelium. Okay, so looking at some other important features right here. I'd mentioned the urogenital diaphragm earlier. And so this is the urogenital diaphragm right here. And so this is where the spongy, this is where the membranous urethra goes through here. So this is skeletal muscle. This is where your voluntary urethral sphincter would be with the skeletal muscle part right here. So it goes right through the pelvic floor right here. And then when it gets here, that tube is the spongy urethra. And so it comes in 3 segments in the male. Some other important features we can also see for our digestive system bit. So there is the anus right there. And the anus also is going to have, it'll have some skeletal muscle right here. that is, the regulation here would be voluntary for the external sphincter on the rectum right here, or on the anus, I should say. And then you have an internal one, which is smooth muscle too, which you can't see here. So this is the rectum right here. You can see some other features right here. So you can see the ureter coming down right here. And some other important features right here. Okay, so that's part of the intestine right there. It's part of the colon right here. And so that's the sigmoid colon is like right here. So that's what that's showing right there. Yeah, I think that's pretty much most of it.